you're always playing board games. I wish I had Monopoly. Oh, would you mind? I wish I didn't care all the time. We're just playing hide and seek. It's getting hard to breathe under the sheets with you. I don't wanna play no games. I'm tired of always chasing after you. I don't give a fuck about you anyways. Whoever said I don't give a fuck about you? You never share your toys or communicate. I guess I'm just a play date to you. Ring around the rosy. I never know what you need. Ring around the rosy. I wanna give you what you need. I don't give a fuck about you anyways. Whoever said I don't give a fuck about you? You never share your toys or communicate. I guess I'm just a play date to you. You know I'll give a fuck about you every day. Guess it's time that I tell you the truth. If I share my toys, will you let me stay? Don't wanna leave this play date with you. I ain't tryna. Yeah, ain't tryna be cool like you. Wobbling around in your high heel shoes, I'm clumsy. Made friends to the floor. 2 for 1, you know I'm bitch 5 for it. And you let me, you know I always rock. First thing a girl did was pop on the whole damn cake and the cherry on top. Shook up the bottom in a good girl. When did you hit a party? Ken in the club tryna play for Barbie. I don't wanna go with the flow back then until I touch my toes. I don't wanna roll the glow. Wrist full of rocks and I hope I flow. Pick up yourself 'cause you know they don't. I choose you 'cause they hope I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like boss. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like boss. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like boss. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like boss. On the ass, you've been the beat for. I've been the stallion, you've been the seahorse. Don't need a report, don't need a press run. All of my bad takes been on my best one. I wear the hat and I wear the pants. I am a jam, so I get advanced.
Good afternoon, everyone. Good afternoon, Doc.
Hello, good afternoon.
Hello, Doc. Good afternoon. We will
Good
start in a few
afternoon.
minutes.
Doc, as of the moment, Doc, we are only 354 in the Zoom, but we are still waiting. We're expecting 1,000 participants for this seminar, Doc.
So we will just wait for about 5 or 10 minutes.
Yes, Doc.
Yes, Doc.
Okay.
Thank you, Doc.
a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass. I'm a bitch, I'm a boss. I'm a bitch and a boss, I'ma shine like glass.
Good afternoon once again. Please sit back, relax, because in 10 minutes time, we're about to start our seminar.
Shampoo lang, kulang because it may stop at the circle. If you don't wanna see me,
Eh, man.
crazy. Thinking about the way I was. Did the heartbreak change me? Maybe, but look at where I ended up. I'm all good already, so move on, it's scary. I'm not where you left me at all. So, if you don't wanna see me dancing with somebody, if you wanna believe that anything can stop me, don't show up, don't come out, don't start caring about me now. Walk away, you know how. Don't start caring about me now. Aren't you the guy who tried to hurt me with the word?
I'm a bitch. I'm a boss.
Babe. We request everyone to please put yourselves on mute. Do not unmute unless someone is talking po. Thank you.
Good afternoon, everyone. Please remain silent and let us put ourselves in the holy presence of the Lord as we begin with our prayer, to be followed by our national anthem and youth team.
Our Father who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, deliver us from evil. eternity. Thy name shall ever be our guide. Thy light, our inspiration. Keep up the light of glowing bright. To thy portals, dear alma mater. Hail, praises be to thee. Oh, what show us the way. Faithful and true, we'll always be to thee. Our alma mater
Good afternoon once again, and please find a comfort at your home as we formally start our seminar. In this time of pandemic we are facing, let us not forget that before COVID-19 come, HIV is one of the epidemic that as of the moment, not curable. So to give us more knowledge, and without further ado, let us all welcome our guest speaker. She had her pre-medicine course, BS Biology, and graduated cum laude at University of Cebu San Jose Recoletos. University of San Jose Recoletos. Graduated medicine course of UV Golias College of Medicine. A postgraduate internship, Governor Celestino Gallares Regional and Training Hospital in Tagbilaran City. Award as the most outstanding surgical intern. A residency training in pediatrics at Cebu City Medical Center, diplomat and fellow of the Philippine Pediatric Society, currently a training officer in the
Hello.
Pediatrics Department of Cebu City Center. A regular instructor, histology and neuroanatomy department at UV Golias of Medicine, department head of medical dental clinic at University of Cebu Lapu-Lapu and Mandaue campus, a visiting consultant in different hospitals. In Vicente Golias Memorial Hospital, Cortes General Hospital, St. Vincent General Hospital, and UC Med, and having a clinic at UC Med at LAFUENTE Medical Clinic. And also, she's a member of Philippine Pediatric Society, Philippine College of Occupational Medicine, and a Philippine Association of Physicians in School Health, and a member of Cebu Medical Society. Please give a virtual applause to our very own Dr. LEAH G. LAFUENTE.
Hello, good afternoon.
Good
Good
afternoon,
afternoon,
Doc.
Doc.
I will share my slide first.
Yes, Doc. Go ahead, Doc.
Bisag kuan pistin ninyo sila.
Can you see now? Can you see my
Yes, Doc.
slides?
Yes,
Ami-
Doc.
Yes, Doc.
Yes,
Can you hear me clearly also?
Yes, Miss.
Yes, Doc.
Okay.
Yes, Doc.
So the title of my lecture is on HIV/AIDS, and always remember that HIV/AIDS is just under the umbrella of your STD or your sexually transmitted diseases. So that's the title, HIV/AIDS and STI prevention and what you should know. This is the outline of my lecture. The benefits of knowing one's HIV status. What are the common sexually transmitted infections? What are the ways of transmission and prevention of AIDS and STI? What are the self-risk assessment for STI and HIV? Where to get help? And what is the proper, how do you use the condom properly? First, we should know the definition. When we say HIV, That refers to human immunodeficiency virus. So that is the name of the virus. And when you say AIDS, that is already the disease. That is acquired immunodeficiency syndrome. Now, when you say immunodeficiency, that refers to the weakening of our immune system. And later on, I will discuss to you what are the parts of the immune system. And when you say virus, that is a form of germs that needs a living cell in order to live and cause the disease. No? So that is the character of the virus. Actually, the virus is not living, but it needs a living host cell in order to cause the disease. No? That is the characteristic of all types of viruses. And when you say acquired, it means you get it from another person, or it is the result of exposure to an infected person. And when you say immunodeficiency syndrome, that refers to the different signs and symptoms which are non-specific. So these different signs and symptoms may mimic other diseases. That is why it is not specific. So the person can have fever, chills, diarrhea, weight loss, or any forms of different presentations. So it mimics other signs and symptoms of the different diseases. So I hope you will bear in mind when we say HIV, that is the virus, and we talk of the disease, that is AIDS, which is caused by HIV. So it is very important for you to know also the different body's defense system, because the HIV virus is so intelligent that it really destroys the specific defense system of our body. First, you should know first what is non-specific defense system and what is the specific. When you say non-specific defense system, this refers to the mechanical barriers present in our body. So it's always prepared to defend our body. So they are the guards, no? They are the external guards of our body. Now, and this different defense system is present in the different organ systems of our body. So example, you have the skin. You have learned this in your biology before, that your skin is lined by group of cells, known as your epithelium. So this group of cells protects your body, Any organism, microorganism that enters into your skin cannot enter immediately, because it is protected by the lining group of cells or epithelium. But if the microorganism will penetrate and gain entrance into your skin, what happens? There will be signs and symptoms of inflammation, which can be manifested by redness of the skin, swelling of your skin, pain that you can feel in your skin, and redness and warmth on your skin. Those are the signs. So with that, we can detect already that there is a microorganism gaining entrance into your skin. Then another organ system that protects us is your digestive system. So also the cavities in our digestive system, like your esophagus, your stomach, intestines, they are also lined by group of cells. And if you will be able to ingest or eat together with the food that are contaminated, when you eat, those microorganisms that are present will enter into your digestive system and it will cause infection. And what is the normal response of your digestive tract? Your intestines or even your stomach will produce hydrochloric acid. that can kill the microorganism. That is a non-specific defense system because not all of the microorganisms will be killed. The rest can pass through the different segments of the digestive system. And normally also, if it reaches the intestine, your intestine also will produce mucus. That is why you will have mucoid type of diarrhea. Your diarrhea or gastroenteritis, and you pass out stools that are loose and it is mucoid, meaning it contains mucus. So that is a non-specific defense system. The same way with your respiratory system. If you inhale microorganisms, the normal response also of your respiratory system is for you to produce mucus and the cough reflex, wherein once you develop more mucus, the tendency is you cough it out. That is a non-specific defense system. For urinary system, if you have urinary tract infection, which is very most common in the females because of the anatomy of the urinary system in the female, because of the nearness of the urethral opening with the vaginal opening. That is why women are prone to urinary tract infection. For the males, the urethral opening in the penile area is far, no? It's far from your anus. So UTI, urinary tract infection in the males, is not that common compared to females. But if there is UTI in the male, the most common cause is the ascending type of infection. When you say ascending, you get it through sexual contact. So if you have infection in the urinary system, the normal response is you also produce mucus and you have frequency of urination and pain in urination. That is why when we get a urinalysis, what we will see in the urine examination is you can see also mucus, no? And also white blood cells. And lastly, for the reproductive organs, so the picture above there, that is the front view of the reproductive organs of the male and the female, and below are the picture of the female and the male reproductive organ on a side view picture. Now, if a male or a female has infection in the reproductive organs, the most common cause of which is sexual contact, the common manifestation is also mucus discharges, no? Mucoid discharges. As I have said, the lumen or the cavity there in your penis and the cavity also in the female, which is the vagina, it is also lined by epithelial cells, which also produce mucus if there are microorganisms that enters into your reproductive system, so that both males and females will manifest discharges. So that is most common on the other sexually transmitted infections, except HIV/AIDS. The specific defense system. So this is the type of defense system that will surely kill the microorganism because it is more specific. And we are referring to our blood, no? The immune system, our blood. So when I say immune system, always think of the blood because the component in your blood, specifically the white blood cells, this is the soldiers of our body. The white blood cells will recognize and fight any microorganism that enters into your body. And what are the cells of your white of the different what are the different types of white blood cells in your immune system? As you can see there on the picture below, there are several white blood cells. Now you have there the neutrophils, basophils, the monocytes, and the lymphocytes. And there are two types of lymphocytes. You can see there in the picture the B cell and the T cell. And it has a very specific role when a person will be infected by HIV virus. Very intelligent ang virus because it knows what to destroy, no, in our body. So the lymphocytes has two types, no, the B cells and the T cells. The B cells is being produced in our bone marrow, as you can see there in the picture with the long bone. Inside the long bone, you have there the bone marrow. The bone marrow is the one that produces the B cells, no? And these B cells, once it is being produced, it also produces substances known as your antibodies. And these antibodies are the ones that will fight against specific or microorganisms. On the other hand, your T cells, it is produced in the thymus. If you can look at there on the picture, on the chest area that is located between your lungs, that is the thymus, and it produces your T cells. And what is the function of your T cell is that it produces chemical substances known as your cytokines. And these cytokines also will destroy any microorganisms that enters into our body. So always remember the lymphocytes, the B cells, and the T cells are the ones that is being attacked by HIV virus. And later on, you will know why and how. Then once the B cells and T cells are being produced, and once they become competent enough to fight, they will migrate to the lymph nodes. So you can see there the picture, the green circular structures there, that is the lymph node. In the Visayan term, what is that? That is your lisay, no? So lymph node is the lisay. So these B cells and the T cells, adto din na sila mo, padagan dayon sila sa lymph nodes, no? And also into the spleen. And there in the lymph node and the spleen, it will encounter with the different microorganisms or the foreign microorganisms that enters into our body. And these foreign microorganisms, mao na gitawag na tuog antigen. Mao na ng antigen, no? So the B cells, T cells will fight against the antigen, be it a virus, be it bacteria, or any types of microorganisms. So you should always take note that our immune system must first meet, no? They meet first the microorganism, and they are primed first by an initial exposure to that foreign substance or antigen before it can protect our body. Ila-ilahon pa usa niya, no? Inanak ka bright sa dang atong immune system, our white blood cells. So look at the picture there. That circular red color, that is the red blood cell. That whitish structure with an inner nucleus, that is our white blood cells. And that greenish structure with spikes, that is the virus. No, mura po siya COVID virus tan-aon, no? Naa siya mga thorns. It has spikes, no? So what will happen? So it is the B cells and the T cells that will destroy this virus. If this is the HIV virus, it will destroy this HIV virus. So the immune system protects our body directly by cell attack or indirectly by releasing chemicals. As I have said, the cytokines that is released by your B cells, and you have the production also of your antibodies that will also fight against the virus. So what happens when the HIV virus enters into our body? So it will attack the T cells, no? The T helper cells. He knows what to attack. It is the T cells that he will attack, so that the T cells will not be able to identify him and will not be able to produce antibodies against him. So what happens? The virus, the HIV virus, will take over the function of the T cells, no? So mura na siya ng pirate, no? Mga pirata, no? Like for the mga seaman in a ship, di ba? Usay na yung mga pirate. So, yeah, it will take over the function of the captain. That is also the role of the virus. It will take over the function of the T cells, so that the T cells will later on will die. And once the T cells will die, the virus will then make several copies of himself, no? It will multiply. And you should take note, ang mode of reproduction of the virus is very simple. Just a split of the second, it becomes 2. It splits into 2. That is the simple reproduction of the virus. So that the HIV virus will multiply, and later on, the T cells will decrease in number and up to such time that it will be consumed. And that is the reason why our immune system will be weakened. So can you follow? I hope you can follow the reason why the HIV virus will destroy our T cells, no? Our immune system. So over a period of years, HIV number gradually increase, no? HIV number gradually increase, and helper T cells will decrease in number. So if we take a normal blood count for helper T cells, normally it is about 1,200 T cells per microliter of blood. But for an AIDS patient, the helper T cells will decrease to less than 200 cells per microliter. And it will not be enough for the helper T cells to protect our body. So that is why our immune system will collapse, no? Because of the decreasing number of T cells. What are the stages of HIV? First, HIV enters into our body. When I say the virus enters our body, that means infection. Do not be confused of the word infection from disease. When any virus or bacteria enters into your body, that is infection, but you don't show any signs and symptoms. But once you develop signs and symptoms, then you have the disease already. So again, do not be confused with infection from disease. So first, you can have the infection first. HIV enters into our body. Then it will destroy the helper T cells. So the response of the T cells is for it to produce antibodies against the HIV virus and to produce chemical substances known as the cytokines to destroy the virus. So that is the first stage. Then once the virus is there already, you have the so-called HIV window period. So what is window period? If you get a blood test for HIV, then it becomes negative. And you are sure that you can be infected because your sex partner is positive for HIV. So once you have sexual contact with a partner who is positive, most likely, almost always, the virus can be transmitted to you. And when you get a blood test and it becomes negative, do not be happy yet, because maybe you are still on the window period, wherein it will take 3 to 6 months to detect the antibodies in the blood. No? Do not be happy because you may be in the window period. Then, after that, after maybe 6 months, you repeat the blood test. If you have high index of suspicion that you can be infected, then you repeat another blood test. You can repeat 3 months after or 6 months after. And by that time, you become positive. So, you will, once the virus is there and you become positive, then you will be labeled as HIV positive. Or you will be called as person living with HIV. So the virus will remain forever inside your body. Once it gains entrance into your body, it remains inside your body, and the HIV virus will not leave you until you die. So that is why in HIV/AIDS, there is forever. There is forever in HIV because the virus will not leave you. So since the virus is there inside your body, you can potentially be infectious. And if you engage with sexual contact with a partner, you may unknowingly infect your partner. No? If you do not get a test, you do not know whether you have the virus. And presuming you have the virus but you do not know, it's because you don't have any testing done. Then you engage with sexual contact with somebody. For sure, you can transfer the virus to your partner. So you may unknowingly infect your partner. Then you may say, Doc, I am positive for HIV virus. And why is it that I don't develop any signs and symptoms? Maybe the laboratory is mistaken. No, because you might be in the asymptomatic stage, wherein you do not develop signs and symptoms yet. And you have the virus, but no signs and symptoms. Maybe you are incubating. So that is known as your incubation period. From the time the virus enters into your body before you develop the signs and symptoms. That period there, that is the incubation period. And you have to take note that the HIV virus has a very long incubation period. And it may take about several months to even up to 10 years before you develop the signs and symptoms of a full-blown AIDS patient. Now, after you're asymptomatic, you don't develop signs and symptoms. What's next? You have the AIDS-related illnesses, wherein you develop signs and symptoms of the illness, and the most common form of illness is due to an opportunistic infection. And what do you mean by opportunistic infection? These are the infection that is caused by either bacteria or virus that will that are opportunistic, that will wait until such time that your immune system becomes weakened much so that it will activate, no? The virus or the bacteria will then activate. And the most common type of opportunistic infection is B. Tuberculosis is the most common type of opportunistic infection in AIDS. Tuberculosis ranks alongside with HIV as the leading cause of death from an infectious disease, and it is caused by Mycobacterium tuberculosis. And you have to take note that 74% of your TB cases is among people living with HIV worldwide. No? Those living with AIDS, with HIV, 74%. is due to tuberculosis, the TB bacilli. And TB is also the 6th leading cause of morbidity and mortality here in the Philippines. And the Philippines ranks 9th out of the 22 highest TB burden countries in the world. And the highest burden also of multi-drug resistant TB. What do you mean by this? Multi-drug resistant TB. Those patients who are resistant to anti-TB medications. So they are labeled as multi-drug resistant TB. And these persons, nga nung na multi-drug resistant siya, it's because of the attitude of most of the Filipinos, no, regarding compliance with the medications. TB medications are free, no, in here in the Philippines, no. Our government has supplied anti-TB medications, but yet some of the patients will not even take the medications, even if it is free. And why? What could be the possible reason? It's because once you have TB, there is long duration of treatment, which is about 6 months duration. So taas kaayo. So that's why some patients will not continue. And without realizing that the TB bacilli will become later on resistant, so that next time you give the anti-TB meds, there will be no more response at all. So we have the so-called TB and HIV co-infection. That means if you have HIV plus you have that TB, that is very much a fatal combination. HIV infection contributes to increase in number of TB cases. Bati kay nga combination ang HIV plus TB. The same way as positive kag HIV, ma-infected pag yun kag COVID now, that is also a fatal combination. No? So, the same way also as positive COVID o nya positive kag flu, that is also deadly. That is also a fatal combination. So, mauna, the TB plus the HIV, fatal na siya. Now, HIV positive individual are likely to develop TB than those without HIV. Why? Those without HIV, their immune system is strong. That is why they will not develop TB. So, if your immune system is strong, then if you will be infected with TB, it's your immune system that will fight against the TB bacilli, and you will just heal on your own, no? Even without medication. That if you have a very strong immune system. But in HIV patient wherein the immune system is so weakened, then you will die because of the TB, because your immune system cannot protect you anymore. So TB is the leading cause of death in adults with HIV. 1 for every 4 persons with HIV is dying from TB. And the mode of transmission of TB is also airborne. Airborne particles as a droplet nuclei, measuring about 1 to 5 microns in diameter. So it is very microscopic, very small. That it is, once you cough, once you sneeze, once you shout, sing, or even spit, you can transmit the droplet nuclei, no? And be suspended in the air. And when somebody inhales that droplet nuclei in the air, then that person can be infected with TB. So the transmission occurs when a person inhales the droplet nuclei containing the Mycobacterium TB. Then age-related illness also, not only TB, no, the opportunistic infection, there are also several manifestations of the AIDS-related illness. So it may vary it may vary its signs and symptoms depending on the opportunistic infection present. So it may involve the lungs. So if not TB, then it can cause pneumonia, known as the pneumonia that is caused by your pneumocystis carinii. So look at the X-ray on the middle part of the picture. So that is the example of the X-ray of a patient with pneumocystis carinii pneumonia. Another manifestation, other related illness in HIV/AIDS, it could be ophthalmologic. So it may involve the eye. So it can result to retinitis, wherein it will cause inflammation of the retina of the eye, so that some patients will have blindness later on, no? Because of the involvement of the retina. Another related illness, it could be neurologic. So it can cause inflammation in the brain, causing encephalitis. Or it may involve the gastrointestinal tract, causing gastroenteritis, so that most of the HIV patient will develop diarrhea. So magkalibang sila. Chronic diarrhea, when you say chronic diarrhea, long duration of diarrhea, several months, even years of diarrhea. Or it may involve the skin, causing Kaposi sarcoma. Look at the picture below. That is the picture of a patient with Kaposi sarcoma, cancer of the skin. So these are all AIDS-related illnesses, no? So in anak ka bright ang AIDS, ang HIV virus, it will destroy our immune system so that we don't have any protection anymore, and several microorganisms that enters into our body, causing different types of illnesses. So the terminal stage, no, of AIDS is the so-called AIDS syndrome, no? Acquired immune deficiency syndrome, wherein your lymph node can no longer contain the virus, and your immune system becomes very weak and later on collapses. And if your body don't have any form of protection anymore, several microorganisms, be it bacteria, be it virus, entering your body, then it will later on cause you to die. So the end result will be death. So those are the stages of HIV/AIDS. So in acquired immune deficiency syndrome, you have so much virus in your body, you have badly damaged immune system, and you get various AIDS-related illnesses, and later on you will die. That is an example of a person with AIDS. And how can you get HIV virus, and how can you prevent yourselves? You will memorize only these three. Just memorize and understand the three modes of transmission of your virus. One is by blood and blood products, through drugs, injection with drugs, or through blood transfusion. Second, sexual transmission. Third, mother to child transmission. If the mother is positive, then she can transfer the virus to her baby because of the connection between the mother and the baby, which is the placenta. So how can you prevent the transmission of blood and blood products? So that is why in hospitals, no, if you will be given blood transfusion, we should make sure that we will select donors who does not have risk behavior. Unsa man ang risk behavior? Unsay common risk behavior? Those persons having multiple sexual partner. Those persons with history of sexually transmitted infections. No? Second, those persons who use illegal drugs and using contaminated needles and syringes. Those are high-risk behavior. So, dili dyan na siya pwede ma-donor, no? For blood. And how can you prevent? Through sexual transmission. Always remember the A, B, C, D, and E. A, you should abstain from having sexual contact if you are not ready. Mingon man ka, Doc, I am always ready because I am healthy. You are ready, but make sure that your partner does not have history of sexually transmitted infection or do not have or is not infected with HIV, or your partner is not having multiple sexual partner. Daghan kaayong team ang imuhang sexual partner. No? So, you should abstain if your partner has all of those risk behaviors. So, abstinence, ayaw na lang. No? Do not submit yourself for any forms of sexual activity. No? If you are not sure of your partner. Second, being faithful and monogamous to a partner who is also faithful and monogamous to you. No? Then, third, correct and consistent use of condom. But, there is a very big but for condom. It is not 100% protective. It cannot protect 100%. Even if you use it consistently, every time you engage in sexual contact, naa-adjud na'y condom. And you feel nga, sure na gyud ta ani, nga di ta ma-infected because I am using the condom. No, that is not 100% protective. Always remember, in medicine, there is no such thing as 100% in medicine. It's only 99%. The 1% comes from the Lord. No? And there is no 100% laboratory test also. So, as I have said, there is no 100% in medicine. Even if you are using condom, it is not an assurance that your partner will not get pregnant. No? If you can hear several stories when a woman will say, how come I became pregnant when in fact we are using condom? No? Sipiat na sipiat me. No? So, again, there is no 100% in medicine. So, condom is not that protective. Letter D, don't do drugs. Always remember, loss of self-control happens when one engages in sex under the influence of drugs and alcohol. Why? No? Groggy naman ka. No? If you are taking drugs, if you are taking alcohol, and you are on the late stage of alcoholic drinking, groggy na, you look at the face of the woman, even if the woman is ugly, you can see the woman still pretty. No? So, that is the problem there. So, you don't have any control anymore. Then, E is education and early diagnosis. That is why we are here, for you to be informed. No? We are giving you this lecture for you to be informed how the virus behaves and how it can destroy your immune system and later on cause death. No? Now, another mode of transmission, mother-to-child transmission. So, this happens during pregnancy. If the mother is pregnant, she can transmit the virus to her baby because of the connection, which is the placenta. In the Visayan term, the placenta is the inunlan. No, it's the inunlan. Then also during labor and delivery, that is why when a woman gives birth in the hospital, it is routine already that we will take lab test for HIV and hepatitis B, no, to all women giving birth, so that the healthcare workers will know if you are infected or not. So that during delivery, if you are HIV positive, then the health worker can make precautionary also to prevent the transmission during labor and delivery. And also it can be transmitted to breastfeeding, but in spite of being positive, we still encourage all mothers to do breastfeeding. Why? It's because the breast milk, the first few days of milk that is produced by the mother contains colostrum. And colostrum contains antibodies. And it is very helpful for the baby to prevent the baby from having diarrhea. So the first 3 days of milk that is produced by the mother is the first immunization of the baby. That is why we still give or allow the mother to breastfeed her baby. So 4 body fluids known to transmit HIV. So blood, semen, vaginal or cervical fluids in the female, then in the breast milk. No, those are the common fluids that will contain the HIV virus. You have to take note that the HIV cannot be transmitted through talking. So if you have a friend who is diagnosed to have positive HIV, what happens? Some of the friends will not talk to that friend anymore. Why? Because of the fear that he might infect you. No, the virus cannot infect you, cannot spread to you through talking. So it cannot be transmitted through talking. Even kissing, embracing, and hugging, no? So I can just remember the students last year when I made this lecture, when I said it cannot be transmitted through kissing. Sus, mangyagit din mga students. Hay, salamat. No? Then another transmission that it cannot be transmitted is through mosquito bites. It cannot be transmitted also through sharing utensils with a person who is positive for HIV. Even swimming, there is no danger there. Sharing of toilet seats, sneezing and coughing, no, dili man nimo ma-transmit. Shaking hands, working with someone who has HIV. As what I have said a while ago, there are only 3 ways that the HIV virus can be transmitted. No? If you can still remember the 3 modes of transmission, can you tell me? Anybody can tell me? I just want to check if you really understood what I have lectured a while ago. What are the 3 modes of transmission? Kadto yung tulo nga dapat ninyo i-memorize. Anybody can answer? Hala, wala, naminaw. Can I call? Sa ako makita ha din he. Can I ask Aterado? Who is Aterado? Can you answer me? What are the 3 modes of transmission of HIV? Aterado? You can call a friend so a friend can help you. What is the answer?
Yes, Doc. The 3 transmission of HIV, Doc, is
yes.
First is blood to blood transmission. Second
yes.
is through sexual intercourse, and third is from mother to child transmission, Doc.
Okay, very good. So at least I have known that you really listen to my lecture, no? So only those 3. Okay. How would you know if
Okay.
can you hear me? Can you hear me? Everybody can hear me?
Yes, Doc.
Okay. So How will you know if you are positive? Get an HIV antibody testing. No? It is a laboratory process done to determine the presence of antibodies to HIV virus. So what are the high-risk behavior? So try to assess yourselves if you have these high-risk behaviors. 1, if you are using drugs, injecting drugs. 2nd, sharing of unclean, contaminated, injecting paraphernalia. Thirdly, presence of the other sexually transmitted infection, no? Unprotected, penetrative sex. So unprotected, penetrative sex, so no condom at all. Intoxication with drugs and alcohol, and multiple sexual partners. These are the high-risk behavior. If you have one out of these, then you are most likely to be infected with HIV virus. So what are the benefits of knowing one's HIV status? In order for you to learn ways to practice a healthy lifestyle. So if you have a high-risk behavior, so you better think now. If you want to become infected later in the future, or you want to stay healthy, no? It's your choice. Another reason also is early access to treatment and care. It is necessary for you to know your HIV status. Thirdly is to get access to services that lowers the chance of passing HIV from mother to child. When you get an HIV test, before you submit, no, for the testing, there is a pre-test counseling first. Naapay pre-test counseling. After that, you consent, no? Informed consent. Then after that, blood will be extracted for HIV testing. Then, once the result is given or is available, there will be another post-test counseling. And if you become positive, then you will have the referral to the infectious specialist or to DOH. So referral could be done and support also can be done. Things to remember, AIDS is incurable. So it cannot be treated and it can cause death. It is fatal. HIV infection is lifelong. As what I have said before, HIV infection will take several months and even up to 10 years before you develop the signs and symptoms. So the incubation period is so long. And a person with HIV is infectious for life. And anyone can get HIV virus if you engage in high-risk behaviors. And you cannot tell who is infected because the person don't show any signs and symptoms, not unless the person is on the terminal stage of AIDS or the last stage of AIDS. And always think that HIV AIDS is preventable. It depends upon you. You should live a healthy lifestyle. You should practice a healthy lifestyle. So before I will talk on the STI or the sexually transmitted infection, can I ask Mr. Bidinya, Cadet Bidinya, if you can share my video on the life story of Charles, who is having or who is living with HIV/AIDS. Before I will proceed with the lecture on STI. Cadet Bidinya, can you share the video of the life story of Charles?
Yes, Miss. Makita na akong screen, Miss.
Wala.
Wala siya, Doc. Okay.
Shall I stop my
Yes,
sharing of the
please.
slides?
Yes, please. Thank you, Doc. How about this, Doc? Makita na siya,
Okay.
Doc.
Okay na.
Okay, thank you.
His decisions in their life.
Yes, miss.
Some come with consequences, some
Okay
major.
na, miss.
My name is Charles. I was born to a loving couple, and although they loved each other very much, they decided it would be best for them to separate. I grew up mostly with only my mother from the time I was 2 until I was 14. With my mother being my major inspiration then and throughout the rest of my life. My academic career at this point was very active. I was involved in the choir, student council, band, football. At the age of 11, my mom married someone that I did not get along with, causing me to rebel. Soon after that, at the age of 13, my mother had a major stroke, paralyzing her on the right side and taking away her ability to speak. The stress of all this broke the camel's back for my stepfather. At the age of 14, he dropped me off at CPS, Child Protective Services, not CPS Energy. I watched him drive away with my mother in the car. Eventually, I was sent to a foster home. When I was 15, I ran away from the foster home because of violence and lived on my own without telling the state where I was, afraid of being returned to the foster home. So they emancipated me and set me free. I worked and went to school in order to complete my education. Once I graduated, I joined the U.S. Army. After basic and advanced training as a medic, I was stationed at Fort Ord, California. For the first time ever, I fell in love. Me and my first partner then had a healthy baby boy together. We decided after 4 years that it was time to split. I then moved to Los Angeles and ultimately met my second partner. Now I don't fall in love easily, so I was on a roll. However, I knew there were health problems with my partner when we began dating, and these health problems were usually associated to AIDS. But it didn't seem to matter to me. I didn't ask any questions. You would have told me, oh, I'm HIV positive, and I would have said, oh, okay. All I cared about was being in love at this point. When my partner died one night, it was at that point that I realized that I may have put myself in danger of getting what my partner had. I still didn't rush right out to get tested even after my partner had died because I figured I was all right. I wasn't as sick as my partner ever was, and I generally thought I was invincible. And when I did get tested, my results came back negative, so I was okay, right? I went about 4 or 5 years just working and dating on and off. One morning I woke up and couldn't breathe. I thought I was having a heart attack, and at the age of 27, that was scary. When I got to the hospital, the nurse came to check my vitals, and as soon as I sat down, I blacked out, waking up 2 days later. I woke up learning that I was HIV positive. I met and started dating my third partner. I figured I'd made it this far, I could not get sick from it. One night I was at work and my partner died of complete organ failure. I was devastated. Then my mother died 2 months later. I was really devastated. I went into a depression, working 12 hours a day and then going home and sleeping. I went on a couple of cruises and then decided to move to Cancun to get away from it all, thinking it would make everything better. Well, with the lack of medication and the lack of health care while in Mexico, little did I know I was getting more ill on the inside. My friends noticed it and said something about it, but I blew them off as thinking they were just jealous of me living in Cancun. After a couple of months of nagging, I finally moved back to San Antonio to be closer to my friends. I then went on 24 more cruises in 2 years, and I was having a grand time. I was feeling great, and then all of a sudden, I started not feeling well. It started off with shingles, and then I noticed my eyesight starting to change. I thought it was just because I was getting old. I got so tired, weak, and feeble and went to the hospital, found out that I needed medication, and fast, since my T-cell count was 41. So they started me on some medication, and I was very upbeat about it until we found out it was not working. I literally wasted away and ended up back at the doctor's office weighing only 97 pounds, and she recommended that I go to the San Antonio AIDS Foundation house, which she explained to me was a hospice. At first I thought, there's no way. A hospice is where people go to die, and I believed that I wouldn't die. After a month of getting nothing but worse at home, it was the San Antonio AIDS Foundation house that made sure I took my medicine on a schedule and made all my doctor's appointments on time. They also made sure that I ate right. After a month of going and seeing the doctor regularly, I was starting to feel much better. It was at this point that I started to figure out that taking the medicine on a schedule was a very important part of getting healthy. As healthy as I may be now, I will never be like I used to be because of the decisions that I made in my life. Now I have to live with the consequences forever. You don't need a picture of how I look today because, well, I'm in front of you and I've just told you my story. Protect your life by protecting yourself. If you have questions, just ask. Thank you for letting me tell you my story today, and I hope it helps you in making some of the right decisions for your life.
Can I share again my slide, ma'am?
Yes, Doc. Well done, Doc. Go ahead, Doc.
So before I will proceed with my remaining lecture on the other sexually transmitted infection, I would like to dissect the case also of Charles. So may I ask, what if you have listened carefully to the life story of Charles, what is in the pertinent history that you consider as a risk behavior why Charles was infected with HIV? Anybody can volunteer to answer? Can I ask Giancarlo Maneja to please answer? Basing on the history revealed by Charles, unsa may risk behavior niya nga nganong na-infected man siya with HIV?
Bisag sa mga girls ang kuan.
So Charles had multiple sexual partner. Imagine ang iyahang partner tulo ka buok aside from kadtong on and off nga gipang date niya, no? So it was his second partner who was positive for HIV, and that partner infected Charles. And when the second partner died, that's the time when he submit for HIV testing, no? And the result was negative, no? Pero ang cause of death of the second partner was multiple organ failure because of the HIV/AIDS infection. But si Charles, negative ang iyahang HIV test. What could this be? Nganong na negative man siya? What stage is nga nahitabo ni Charles? On what stage of HIV siya? If you can remember the window period, no?
Symptomatic, Doc.
No. Window period pa.
Incubation.
Incubation, Doc.
Second
maybe
second
Charles
stage,
is
I
still
thought.
in the window period. Yes, we're in when you get a blood test negative, no?
Sunya din. Oh. Asa nga madano? Asa nga madano? Chris nga madano.
Can you hear me?
Yes, Doc.
Okay.
Yes, Doc.
So,
Yes, Doc.
after namatay ang second partner ni Charles, so that's the time he started on dating na po until he met her third partner. But the third partner na infected man po, no? The third partner died of multiple organ failure, and because of that, nisunod po kamatay ang mother, he went into depression. So nag-depression na siya. Then he transferred to Mexico, but that was the time when he got an HIV test, na positive na siya. So when he was positive, there was no medications at all. No, wala gid siya gitake na medication until such time nga he felt very weak, no? At first he got shingles. Ang shingles is herpes zoster man na siya, which is also a viral infection. So nag-zoster siya, nag-shingles, then later on his eyesight changed kuno, and later on he felt tired and weak. And because of this, that was the time, at first, gi-ignore pa niya because he was thinking that it may be due to old age. But later on, he felt so ill, gyud nga niadto na siya hospital. And the T-cell count niya was only 41. Imagine 41 iyang T-cells. Then he was referred to a hospice, no? A hospice is a San Antonio Foundation house. It is a hospice for AIDS patient, no? And maoto dito na siya ni-improve because of the regular compliance of the medications. So that was a very sad story, good, no? Ni Charles. So I hope you will learn from the story of Charles. You should take care of yourselves, no? Make sure if you are having high-risk behavior, take a test, no? Take a test. We will proceed with the other sexually transmitted infection. So same with HIV/AIDS, the transmission is sexual contact through blood and through mother-to-child transmission. So these are the common sexually transmitted infection. Og aritag bacteria, multiple choice, you can choose. Gonorrhea, syphilis, chlamydia. If you want viral, you can have genital herpes, no? Then you can have the genital herpes. There are two types of herpes, the herpes zoster and the genital herpes. Then you can have genital warts, genital molluscum, HIV, and the hepatitis B virus. For the protozoal, you have trichomonas, then candida for fungal and the skin parasites, no, mga lice and scabies. Now these are the common bacterial cause, no, of sexually transmitted infection. So if you can see there, the most common presentation is you can have discharges, you can have sore, no, mag-ulcer, no. Look at the second drawing there on top. That is the oral mucosa, that is the mouth. Then you can have sores also in the mouth. On the right upper picture, the right side, that is the cervix that produces discharges, no? You can look at the discharges, it is whitish, no? And it is creamy looking. Then look at the picture below on the left, that is the baby delivered by a mother with gonorrhea, no? Na-infected po ang eyes sa bata. Then look at the middle picture below, that is the sore, no, in the penis. And on the right side, that is the vaginal area of the female that contains also sores, no, na ay mga sore. Now, first for the gonorrhea, which is caused by Neisseria gonorrhea. Ang common presentation for both the males and the females, you can have burning sensation when you urinate. You can have itching, or you can have, for the female, you can have bleeding or pain and discharges. The same way with the males. You can have painful or swollen testes, and you can have itching also, and you can have bleeding. Those are the common manifestation for the gonorrhea. For the syphilis, always remember ang syphilis, it has 4 stages. No? For the primary stage of syphilis, the presentation is that of a single open sore in the penis. No? And also in other areas, no, naabot na guys kamot, no, ang sore. So the sore will appear 10 to 19 days, 90 days after the infection, after the entrance of the bacteria to the body. So layo kayo, no, 10 to 90 days ang iyahang incubation period. But because you may be shy consulting a doctor, you will not seek consultation because mauwaw man mo. But later on, it will just heal spontaneously in 3 to 8 weeks time. So later on, uy, ni ayo raman, ni heal raman even without treatment. So you think nga, okay ra to. But without you knowing, primary infection na dito of syphilis. Then later on, it proceeds to a secondary infection symptom. So it will occur 3 months after contracting the infection. And you will, the most significant presentation sa secondary stage of syphilis, the rashes on the body and even in the palms of your hands, no? And it can mimic flu symptoms also. So you feel the flu ra jud ko ani, no? Without you knowing, uy, secondary infection na dito of syphilis. But later on, these symptoms will disappear na po on their own. And it will last 3 to 12 weeks before it enters into the next stage, which is the latent stage of syphilis, wherein you do not show signs and symptoms. And it may even last for up to 30 years. Then it proceeds to tertiary infection, wherein this is the most destructive stage of syphilis, wherein you will have multiple organ damage also, no? Especially the vital organs, and it can cause the death of the patient also. So be careful also with syphilis. Then the chlamydia. In chlamydia, also, it is with burning, discharges, itching, pain, and swelling, no? So more or less the same manifestation. Chancroid, this is caused by Haemophilus ducreyi. What you will feel is a small bump in the genital area, which later on becomes ulcerated, mag-ulcer siya. Then, for the viral, the common STI caused by viruses, the number 1 is HIV. No, I have discussed naman HIV, so we will discuss the remaining viral cause of sexually transmitted infection. So you have the genital herpes. Look at the penis, no? It has several small red sores there around the penis. And later on, mo-blister siya. Kana mo-blister mo siya magtubig. And later on, it ruptures. Then there will be scab formation, murag mukugan, and eventually heal. So that is the manifestation of genital herpes. Then for the human papilloma virus or the HPV, maunay gitawag na to genital warts. In the Visayan term mo na gitawag og kungo, no? If you can, there are several persons man nga naay gipang kungo, no? That is warts, no? Look at the penis on the upper left picture, no? It is surrounded by warts. Look at also the second picture on the right side also. Those are the warts in the female genital organ, the vaginal opening, near the vaginal opening. And look at the picture below on the left. That is the picture also of the genital wart in the male that is not circumcised. for a penis of a male nga wala gituli or not circumcised, kanang naaman siya gitawag og kanang foreskin, no? Naaman ay foreskin gihapon if you are not circumcised. Just pull it back, then you can see all of these warts inside the foreskin, no, of the penis. Hepatitis B is also sexually transmitted. So the manifestation of hepatitis B, if you develop abdominal pain, yellowish na discoloration sa skin and the eyes, that is already on the late stage of hepatitis B. Like HIV/AIDS and like HIV/AIDS, your hepatitis B also has a window period. Even if you are infected already, na if you get a Hep B screening test, mag-negative siya. That is why I will always advise nga 3 or 6 months after, repeat another hepatitis B. Okay, most likely mo positive na siya. Then for the protozoans, mga parasites na ni, that is transmitted sexually, no? So maybe the hygiene of the person is not good, maoning na ay mga parasites, no? Mga protozoans. So the trichomonas, no? The trichomoniasis, referred as trich. It is the most common cause of vaginitis, inflammation of the vagina, no? So ang manifestation same, common jud kayo ang itching or burning sensation, then discharges, vaginal discharges. Candidiasis, that is fungus, caused by Candida albicans. Presentation same, itching and discomfort. Severe itching, burning, soreness, and whitish gray cottage cheese-like appearance of the discharges. No? Look at the mouth. Nag-candidiasis, no? Na ay whitish coat sa tongue. Look at the picture above. You have there the whitish vaginal discharges. No? That is caused by candidiasis. For the pubic lice, though this is not common here in the Philippines, this is most common in Africa or in other countries wherein there is no good hygiene, no? So we have the so-called pubic lice or the crabs. Kay mura mag-crab tan-awan ang pubic lice, no? So imagine ang imuhang pubic hairs nga nay mga kuto, no? It is so itchy. And the picture below, that is an example of a scabies. So on the left lower picture there, that is the appearance of the organism that caused the scabies, no? You will have very itchy skin rash there or skin lesions in the skin. Actually, the skin parasites is not transmitted by not necessarily sexual penetration, but because of the skin-to-skin contact when engaging in the sexual activity. So, in summary, the common signs and symptoms of sexually transmitted infection, aside from your Hep B and your HIV/AIDS, no? The most common, pain while passing urine, yellowish abnormal discharges, pain during sexual intercourse, severe itchiness, abdominal pain, and ulcerations in the penis or in the vagina. Those are the most common signs and symptoms of sexually transmitted infection. So how will you assess yourselves if you are at risk of getting HIV or sexually transmitted infection? First question, do you engage in unprotected sexual intercourse with more than one partner? Do your partner also have multiple sexual partners? Or do you or your partner have signs and symptoms referring to a possible sexually transmitted infection? Do you engage in drug use, sharing of needles or syringes? Does your partner engage in drug use, sharing of needles or syringes? Or have you or your partner undergone any blood transfusion or organ transplant? So if you answered, even if you have only one yes answer there, then you have a high-risk behavior. So you should try to assess yourself. So if you have a high-risk behavior, What will you do if you think you have STI or sexually transmitted infection? You have to seek consultation. Do not be shy to seek consultation so that you will not end up on the terminal stage of the disease. So you consult and undergo screening for your sexually transmitted infection. Follow and complete treatment for the sexually transmitted infection. And if you are undergoing treatment, we should also treat your partner at the same time. Then we should avoid sexual contact during treatment and always use condom in order to prevent further infection of your sexually transmitted infection or even HIV. So you may ask, how can we use the condom properly? No? Always remember, consistent and correct use of condom lowers the risk of HIV and STI transmission. It only lowers the risk and not 100% protect you from sexually transmitted infection. Here are steps in using a condom. First, you have to talk about condom use with your partner. No? So it is a shared decision, no? Nga magamit jud mo condom. Put on the condom as soon as penis erects. Nganuman, ipa-erect usa una nimo i-insert ang condom. No? It will be easy for you to insert the condom as soon as the penis erects. Press the tip of the condom. When you insert it, press the tip and roll it down the body or shaft of the penis. And if the penis is not circumcised, wala gituli, pull back the foreskin before rolling the condom down the shaft. Immediately withdraw the penis after ejaculation from the entry point. And after removing the used condom, so after using it, you tie a knot in the open end to confine the semen para spill ang semen. And both partners should immediately wash off any semen or vaginal fluid with soap and water. So those are the proper steps. So reminders about condom. Check on the expiration date. Don't use condom with broken seals. No? Make sure it is new. Dili man naginots condom. Don't reuse condom. Gamit rin ako usaboy ako ni hugasan. No. That is dangerous. No? It can be contaminated. Use water-based lubricants such as KY jelly. Avoid lotions or any oil-based products. Store and dispose condom properly because it is non-biodegradable. So where can you get help? So for HIV and STI consultation, so if not with this, if we have, by the way, we have an FB page for the UCLM clinic. It is called as the e-consult UCLM. If you want to seek consultation with me, you can message me through FB, e-consult UCLM clinic. Then you can set appointment through teleconsultation. Pwede rata mag-teleconsultation if you will be shy in going to these clinics, no? So if you will be shy, then you can go to the social hygiene clinics, any government hospitals. But now, because of the pandemic, delikado man tamo adtong mga hospitals. Or you can go to Mandawi City Health or in Lapu-Lapu City Health if you are living in Lapu-Lapu, or any DOH accredited private clinics and hospitals. But if you don't want to go to these government agencies, then you can seek consultation with me through teleconsultation, just like the e-consult UCLM clinic. Then you can send private message, no, on that FB page. So based on the Philippine National AIDS Council, it has been reported that the number of HIV cases in the Philippines is rising at a fast and furious rate. And it is most common among males having sex with males and those people who inject illegal drugs. No, take note, ang one Filipino contracts virus every 1 hour and 25 minutes. Imagine, one will contract the virus every 1 hour and 25 minutes. No? That is the problem now. And we have observed that there is increasing cases of teenage pregnancy. No? Mga teenagers, mga pregnant na. It's because of the premarital sex. And without knowing the consequence of the premarital sex, na anytime you can be contracted with this HIV or any of those sexually transmitted infections. Here in Region 7, Central Visayas ranks 3rd region with the most number of newly diagnosed cases. And top 1 in town ang Cebu. Cebu City top 1, or Cebu, entire Cebu is top 1, no, for the most number of newly diagnosed HIV cases, followed by Bohol, followed by Negros Oriental, then Siquijor. But in Cebu province, the most number of cases, new cases, it's Mandaue and Lapu-Lapu City. So how sad. So the mode of transmission in Central Visayas, number 1 cause good sa Central Visayas why there are increasing cases because of drug addicts, sharing of infected needles. So there are so many, no, persons into drugs here in Cebu Pagyudiay. Through male-to-male unprotected sex, no, the homosexuals. Then 3rd, female entertainment of sex workers. For the national data, the mode of transmission on the national data is due to male-to-male unprotected sex, followed by sharing of infected needles. In Cebu, the age group with the most number of cases is 25 to 34 years old, no? Then followed by 15 to 24 years old. Imagine the youngest age is 15 years old having HIV already, no? So Cebu rank 2, no? Second Jude next to NCR in the most number of persons living with HIV. So the National Youth Commission expressed concern over the rising number of young Filipinos testing positive for HIV. And it is now considered as the worsening youth epidemic. So, as my last slide, it is bad enough that people are dying of AIDS, but no one should die of ignorance. That is why we are here this afternoon, for you to be well informed on the HIV and the other sexually transmitted infection. So alone we can do so little, but together we can do so much. So these are my references, and thank you for listening. Can we share to you, Ma'am Len? Can we
Yes,
share
ma'am.
the
Yes,
video
Doc.
on condom?
Yes,
So
Doc.
that
Yes,
they
Doc.
will know that condom is not 100% protective.
Yes, Doc. Can I have the share screen, Doc?
Okay, ma'am.
Thank you, Doc. Makita na siya, Doc?
Teka, ma'am ha. Wala pa.
Okay, I'll do it again.
The Church teaches that the use of condoms for purposes of artificial birth control violates natural law, is immoral and offensive to God, and is harmful to the well-being of the husband, wife and their marital relationship. Today, many people use the term safe sex as if they are experts on a topic that is supposed to have a scientific basis. Experts they are not, and the term safe sex is not based on sound science or morality. The word safe means free from harm, danger or risk. Safe sex is defined as using a male latex condom during sexual activity where there is exposure to genitals and sexual fluids. Health officials, sex educators, movie stars and other public personalities tell the public that they can have sex with anyone they want, anytime they want, often as they want, as long as the male wears a latex condom, then no harm or danger will come to the people engaging in sexual activity. According to the latest research on condoms and their effectiveness in preventing sexually transmitted diseases, condoms have been found to be anything but safe. The Condom Effectiveness Conference, which was led by the National Institutes of Health, reviewed published scientific evidence on condom effectiveness as of June 2000. Based on the conference findings, here is how condoms stack up against some common sexually transmitted diseases: human papillomavirus, also called genital warts. Condoms offer little to no protection even if used 100% of the time. Trichomonas. No protection even if condoms are used 100% of the time. Syphilis. Condoms reduce the risk of transmission by 29 to 50% if they are used 100% of the time. Gonorrhea. Condoms reduce the risk of transmission by 50% if they are used 100% of the time. Chlamydia. Condoms reduce the risk of transmission by 50% if they are used 100% of the time. Genital herpes. Condoms reduce the risk of transmission by 40% if they are used at least 65% of the time. One study showed condoms reduced transmission risk for women by 25%, but men were still at risk. HIV, AIDS. Condoms reduce the risk of transmission by 85 to 87% if they are used 100% of the time. If so-called safe sex were truly safe, condoms would eliminate the risk of STD transmission, but the NIH study reveals that condoms only offer risk reduction. Read the back of any box of condoms and see that even condom manufacturers say that when condoms are used properly, they do not eliminate, but only may help reduce the risk of catching or spreading many STDs. Realize also that correct use of condoms means using a condom with every act of sex, with no forgetting, and that the 5 to 7 steps for putting on and removing a condom must be followed, since you cannot make mistakes or you will lose the benefit of the condom. And even if you use them correctly, condoms only reduce the risk of STDs, so you are still at risk. 2 things that condoms cannot protect are the heart and mind. Condoms cannot prevent the emotional, physical, mental and spiritual bonds that form when 2 people have sex, and condoms cannot reduce the risk and pain of heartbreak when relationships end. Condoms do not protect against unwanted memories and connections to past sexual partners long after those bonds are broken. Condoms are not the answer. The answer is sexual self-control by developing the virtues of chastity, which is the virtue which excludes or moderates the indulgence of the sexual appetite.
So that ends the video presentation. So, do you have any questions? I hope I have delivered well on the topics. So I hope you have learned also.
Yes, Doc, thank you so much. Thank you so much, Doc Leah, for the discussion, and hopefully it will give us more knowledge, especially to the participants, on how can we prevent and avoid these kinds of illnesses. And then we were enabling the chat box to accommodate at least 3 questions. So you can send your questions now, so I'll be the one to read. And please listen lang kung what will be the answer of Dr. Leah.
No questions?
As of the moment,
are you shy to ask questions?
Gitgano Ralph Joseph, he has a question, Doc.
Yes.
Yes.
Is it advisable, Doc, to PSAT the lymph nodes? Advisable
Again?
Is it advisable without the Doc nga pisliton or ipisat ang mga lymph nodes?
No.
Oh.
Diba? As I have said, we have a non-specific defense system in our body. So, if you prick your lymph node, what happens? There will be injury to the skin, no? And it will allow entrance of organisms. It will cause infection, secondary infection. So, it should not be pricked because you are just allowing the portal of entry of microorganisms. So you can have lymphadenitis, no? Or lymphadenitis or inflammation of the lymph node.
I see. Thank you so much for that, Doc. And
So,
napatay another.
by the
Yes, I'm
way,
sorry.
if
Yes, Doc.
you have an enlarged node, that is a sign that you have an ongoing infection. Huh? That is a sign already.
Okay, Doc. Thank you, Doc. And
Thank you
partner,
so
there
much.
napay isa ka question diri from Caro Glyza. Doc, her question is, for example, na ay HIV ang imong bana, nya ikaw wala tas ganahan mo magka-baby, okay ra if ang sperm cell na lang ang kuhaon, dili ra ba ma-transmit ang HIV? That's from Caro Glyza, Doc.
Kuya, sa check pangutanan.
So, if you can remember my lecture, there are fluids that contains the virus. Diba? Katong mga body fluids, apil ba ang semen, blood, vaginal, cervical fluids, and breast milk? Apil ang semen. And always remember, when you get a part of the, if you get a sperm cell, i-apil madam nimo ang semen or ang fluid, no? The seminal fluid jud imuhang kuhaon, and you will extract the sperm cell. Same ra gihapon na siya. Maingon kag you have the knowledge already nga kanang naa siya HIV. Nya, don't tell me nga not even once or few times nga you did not engage in sexual activity with your partner, no? So kung magkuha lang kag part of the semen, then i-inject baya na sa imuha gihapon. So you cannot say 100% you are safe. It is not 100%. Okay, naag gihapon ang virus diha.
Sige, Doc. Salamat kaayo for that, Doc. Thank you so much. And we're going to have our last question. So this is from Justa Hurrydale. Yung question, Doc, ay what if, Doc, na ako'y HIV, pero wa ka nibuhat atong 3 ways of transmission?
So to,
Bali.
na ay HIV,
Pero wala daw siya nibuhat, maski isa atong 3 ways of transmission.
huh? Are you sure?
Di ba? Ay, di man na possible, Doc, no?
No.
Dapat katudjud siyang tulo. So, yun sa kahat
As
na.
I have said, you have high risk behavior. That is why you will be infected. So wa ka nibuhat diha, but your mother baron positive na transfer sa imuha. Di ba?
Yes.
The same way as Hepa B, no? Ang Hepa B is transmitted by blood, mao gihapon blood, sexual contact. We have several cases. I have cases before kay ang kanimanggong maritime students. I am giving hepatitis B vaccination to maritime students. And before giving hepatitis B vaccinations, mag-screening pagid mi og Hepa B nga screening test. And bisan gali mga maritime students before entry to the maritime course, screen gid gyapon na sila Hepa B, and I have found out that there are some students who are positive for Hepa B. And when I asked for the history, wala siya blood transfusion. Wala siya kanang sexual contact, ni deny gid siya sexual contact. Wa pa gyud in town, Doc, not even once. Then thirdly, so wa na to ang imuhang blood, no? Na-rule out na to ang blood transmission. Na-rule out ang sexual transmission. Third is mother to child transmission. And when I asked for the history, I have known nga ang lola has the virus, Hepa B positive ang lola. Ang mama Hepa B positive sad. And that was the reason why nag-HEPA B positive po ang no? So, it could be wala ka atong duha pero na transfer from mother, from your mother.
I see. Thank you so much for that clarification, Doc. Another question from Kadungog at J, Doc. Yung question kay, is there a possibility nga if positive ang mother sa HIV but inig anak niya, Doc, sa iyang anak ay negative? Daghan ko na dunggan nga ingana nga stories,
Yes.
that how is that so?
What we did in the hospital, kung positive ang mama, most likely mo positive sa ang baby, but it doesn't follow nga right after delivering the baby, inikuha nato sa test sa baby nga positive siya. That is why we have to monitor the baby. No? Naagid tay series of monitoring and mo na i-test gyud nato until such time nga mo positive ra gyud na siya later on. As I have said, ang baby manggod immature pa kaayo iyahang immune system. No? Dili pa kaayo siya mo produce og antibodies. That is why when you get blood test for HIV antibodies, negative pa gyud na siya. So mo na frequent monitoring lang gyud ang baby.
Okay. I see.
So
Thank
as
you
I
so
have
much.
said also nga taas man ang window period, no? Taas ang kayong incubation period. So monitoring lang yun. Frequent follow-up.
Thank you so much, Doc. Ang iyang nasa tay last na question diri, Doc, no? Iyang pangutana kay, what if bag-o pa ka na effect sa virus, then nahibaw-an dayon, na ay possible na mawa na or ma-cure na siya dayon, Doc?
Again,
sa mga doctor?
What if,
what if bag-o pa ka na effect sa virus, then
na infected?
Yes, sir. Yes, Doc. Oo.
Infected with the virus, then?
Yes, Doc. Then nahibaw-an daw dayon, na the possibility na mawa or ma-cure dayon sa mga doctors.
Mawala? No. Once you are positive for life. As what I have said during the lecture, if you are positive for HIV, the virus stays into your body until the time until you die. That is why I said in HIV, you have forever, because the virus will not leave you until you die.
Thank you for that clarification, Doc. And last but not the least, Doc, na i-question ng among chairman diri sa chat. Asya, Doc, what about HIV positive people who are undetectable or have an undetectable viral load due to medication? Is it really true that they have no chance to transmit the virus to their sexual partners? If yes, then why is that so, Doc?
So, not detected ang HIV because they are taking medications?
Kanang viral load due to medication, Doc.
Lagi, you are taking antiviral.
Yes, Doc.
You know what is the role of the antiviral kanang gihatag nato sa atong mga HIV patient. The role of the antiviral is only to stop the further multiplication of the virus. It will stop further multiplication. Panalitan ang viral load nimo kana ra. Unya nag-inom kag antiviral. Dili na siya mo reproduce ang imong virus. Taman ra siya ang iyang gadaghanon diha. So it is the multiplication that is being stopped by the antiviral. But the virus is always there. So you can transmit still the virus to your partner. Pero at least kanang nakuha na siya ba? Na napugnan ang iyahang reproduction.
Thank you so much for that clarification, Doc. So partner, I guess we can have that as our last question. Hello? Press JC.
Yes, yes, partner.
Yes, partner. Na kung ano na ang atong last
partner,
na
can you hear me?
question. Yes, I can hear
partner.
you, partner.
Doc, as much as we want to accommodate everyone, but we have only limited time. It's almost 4. But again, Doc, thank you so much for your discussion, and hopefully it will give us more, especially to the participants
For
and how
those
we can prevent
questions,
and avoid these kinds
for
of
those
illnesses.
questions that I
Participants,
have not answered, you can send message na lang to our UC
Facebook?
Clinic FB page na lang. Private
Sige, Doc.
message na lang, no?
Yes,
Sa
Doc.
e-consult UCLM Clinic.
Okay, Doc.
Private
We,
message
Doc.
na lang.
we will be sharing the link sa inyong page, Doc, and our official Facebook page sa UCCP, University of Cebu Council of President Facebook page. So we will share it ang inyong page dito, Doc, aron makita nila so they can message you directly regarding their concerns about that. So thank you kaayo, Doc, for your time and being with us, and it's really informative and klaro kaayo, specific kaayo ang mga discussion, and your examples are really kanang understandable gid kaayo, Doc. So thank you kay at least naagi awareness bitaw, Doc, labi na ang mga kabatanunan karong panahon na gid, Doc.
You know, the problem now is the increasing cases of teenage pregnancy.
Yes.
And it's because of premarital sex.
I agree with you,
So
Doc.
if you want me to lecture also on premarital sex, then I am willing to give lecture also on premarital sex and responsible parenthood.
Wow, that's nice, Doc. Thank you so much, Doc. We'll contact about that concern, Doc. Salamat kaayo, Doc. Sige, partner.
Yes, and thank you for your time and effort in joining this seminar, everyone. Hopefully you learned something from it, and please apply it. Katong tanang gi-discuss ni Doc, put it in your mind. Be safe and be knowledgeable enough. Thank you and good afternoon and goodbye.
Thank you so much, Doc.
Thank you, Doc.
Salamat kaayo, Doc. Have a Merry Christmas, Doc. in advance.
Babush.
Thank you, Doc.
Thank you, Doc.
So much, Doc.
Merry Christmas. Thank you, Doc.
Bless.
Thank you, Clarence Jimenez.
Salamat, Doc.
Thank you, Doc.
Doc, our chairman will be contacting
Babush,
you.
Doc.
Shout out, Chloe.
Thank you, Doc.
Shout out.
Salamat po, Doc.
Hi, Doc.